Hello everyone, my name is Solgi and today I'll be presenting on our project regarding intervention to increase detection of developmental delays in WIC programs. This project was co-PI'd by Julie A. Reeder from the Oregon WIC program and Catherine Zuckerman from Oregon Health and Science University, with help from Sherry Alderman from Portland State University. A little bit of background to our project. There are many benefits for developmental delays to be detected earlier in a child's development. However, a lot of children are at risk for underdetection of developmental disabilities, specifically children from low-income families. We recognize that WIC agencies see children from low-income families regularly, and we realize that they could be an important source of referral to developmental services. We wanted to increase the number of referrals to early intervention, early childhood special education, or EIECSE, from non-primary care settings, which a lot of low-income children may not have access to. EIECSE provides developmental therapy services free of cost to any family that is referred. And it's important to note that anyone can refer a child to EIECSE, even the family members themselves. Our primary study measures were the number of children referred from WIC to EIECSE in the control versus experimental counties, as well as the percentage of referrals evaluated based on data obtained from Oregon's EIECSE program called ECWET. To do this, we conducted a site randomized trial, which included an intervention to train WIC staff in early identification of developmental delays, using the CDC's Learn the Science Act Early material. This was developmental monitoring material that helped families. We enrolled 7 county WIC agencies in Oregon, 4 intervention agencies, and 3 control agencies. The intervention consisted of an on-site half-day training regarding signs of developmental delay, the use of the LTSAE materials, and referrals to early intervention, early childhood special education. WIC staff were encouraged to identify and refer at-risk children. The control sites didn't receive the intervention training and they continued their usual processes. Unfortunately, COVID-19 started 2 months after our intervention, and all Oregon WIC visits were stopped and transitioned to telephone. So we compare the 2-month period prior to the intervention to the 2 months post-intervention period. Our results showed us that overall, 3 of the 4 intervention sites increased their referrals to EI. 0 of the 3 control sites increased referrals. In fact, they would decrease their referrals from 6 to 2 in the control arm. The total referrals in the intervention arm increased from 5 to 33. In the intervention arm, it's also important to note that referrals increased for both boys and girls of all ages. However, many studies show that 64% of the referrals to EIECSE are for boys. So our project showed that this was the referrals were about the same for both boys and girls that WIC staff were able to refer. 7 children were placed in services and 4 are currently in the referral process. Only 1 did not qualify out of the referrals. These interventions show us that there is promise for reducing disparities in early detection of developmental delays, specifically for low-income families and children. Thank you so much, and I appreciate your time.